Hello, everybody, and welcome to this week's team brief. I can now just say good afternoon to you because it's just tipped over midday. So we've got a number of updates for you this week. I guess the first thing is just to recognise the sort of sombre mood that the country is feeling, and obviously the passing of Her Majesty the Queen last week, and the really impact that that's had and the changes that that's had. And for me, I was reflecting on this yesterday. So a week ago yesterday, we was just finding out who was going to be our new prime minister, and yet here we are, almost in a in a completely different world. Almost, it's been really quite seismic, some of the changes. And as most of you will know, the funeral has now been communicated when that will be, and that's obviously in process. All of the formal recognition. The funeral will be next Monday, the 19th of September. So we're going to just talk about that, the fact that it's been declared as a bank holiday and how that's going to affect Sherwood, and particularly you as members of the Sherwood team. And we put out some communication relatively late last night that does give an awful lot of information around this, but of course what we have to do is we have to balance the recognizing the impact that this the Queen's death will have on our colleagues, recognizing how they may want to celebrate that or watch whatever's happening, but at the same time also that we've got to, as an organisation, of a healthcare organisation, we've got to continue to care for our patients and provide safe and timely care. So within that communication, there's a lot there, but I'm going to pick out a few things today. So I'm joined, and I'll get them to introduce themselves as they go around. I'm joined by Debbie Kersley from our HR team. I'm joined by Maggie McManus from our operational team, and I'm joined by Kim Kirk and Adam Grundy from our vaccination occupational health team. And we'll go through not just the bank holiday arrangements. We'll go through something around the COVID vaccination program, which is restarted, and of course the winter flu jabs. So just in the comms that went out last night, there's a few things that I just draw to your attention. So it's really hard to pitch this at the right level, because obviously some people are very deeply affected and some people are reasonably ambivalent about it. We've put in the communication a whole host of resources if people are affected, and those are around wellbeing resources. There's actually a really good resource in there around Winston's Wish, which is something that we use for our younger colleagues, so children who may be affected by this, and I would just draw your attention to that. In terms of what we're doing as an organisation, there's very little that we can do in terms of marking this. Obviously, we've removed all of the flags apart from the Union flag, and we're flying that flag at half mast. During the past week, we had to put the flag back up to full mast when King Charles III went through the accession, and then that's now come back down to half mast, and it will stay at half mast until the funeral has passed. We're not able to turn the towers purple. I have asked this. We don't have a purple colour on the towers. We only have pink. So what we'll be doing probably the night before the funeral and the night of the funeral is we'll be taking out the top lighting of the towers, so that actually their towers are in darkness as a mark of respect. We've got a book of condolences. There's obviously a national book of condolences on the Royal Family website, and we've got a book of condolences that we've opened in the Faith Centre at Kingsmill. And then the final thing is, again, just something to highlight. We recognise that obviously our patients may want to watch the events that unfold on Monday, and so we've managed to agree with our service TV providers that we can remove the paid channels for the conventional BBC, ITV, etc. channels for the period of that time. So that's the sort of simple mechanics of what we've done. I might just ask those. So Debbie, do you want to introduce yourself, and then I'll go round? So Debbie, Maggie, Kim, and then Adam.
Yes, no problem. Thanks. Good afternoon, everybody. I'm Debbie Kearsley, and I am the Deputy Director of People here at Sherwood.
Maggie.
Good afternoon, all. I'm Maggie McManus. I am the Deputy Chief Operating Officer here at Sherwood.
Kim.
Afternoon, everyone. Kim Kirk, Operations Lead for COVID Vaccination Hub at Kingsmill Hospital.
Adam.
Afternoon, I'm Adam Grundy, and I'm your Head of Occupational Health.
And I probably ought to introduce myself. So I'm Dave, I'm the Medical Director, which is a sort of bit I always forget to do. So just, I don't know if anyone wanted, I don't know how you're all feeling personally in terms of the passing of the Queen. I don't know if anyone wanted to share anything.
Happy to share, Dave.
Go on then, Maggie.
So it was it's been quite surreal. I wouldn't have described myself as a royalist. So I'm quite, I was fairly agnostic, I think I would probably describe myself. But the last week has been quite surreal, because the Queen has been in my life through all of my life, and it's, you know, she's always been there and steadfast, and always the person that you just depended upon to always be there. And I think, you know, when we heard that she'd died last week, it was sort of, it was unreal. And I wasn't expecting to feel so affected by it, but I have, and my children have, and my family have. And you know, as a woman, she was a fantastic woman. The things that she was able to achieve in her position as a woman was just phenomenal. So, you know, I have the utmost respect for her. And I do feel for the royal family at the moment, because they're having to grieve in public, which is hard. And you know, all of us that have been through that, the privacy that you have to enable you to do that is something that is required. So they've got a difficult task over the next couple of weeks. So, and I wish them the very best. Yeah, certainly the images of the four of them around the coffin in St Giles's last night was very poignant. And I'll give my reflections a bit. Anyone else want to? Debbie, do you want to come in?
Yeah, I'm happy to come in and give my reflections. Again, I wouldn't say I am a royalist. However, finding out that the Queen had passed, very sad for us. She's been that stability during really difficult times. I remember the speech she gave when Diana passed away, again when we had COVID, saying that we will meet again, and that's what the country needed. Felt very much like she embodied some of my grandma's traits. So it takes you back to when my own grandma passed away, because, you know, not just look wise, but some of her traits, and equally that she was a very strong, powerful leader, and a female leader, and somebody to look up to as a leader. And I found myself getting very emotional on Friday night when King Charles III gave his speech. I thought it was a very genuine and emotional speech, and it was nice to see that the royal family, or a member of the royal family, was emotional, and understandably so. And that brought out a lot of emotion for me on Friday night. And as you say, Dave, the pictures from last night, the 4 children holding vigil around the Queen's coffin was very powerful. This is not just the Queen, this is a mother and a grandmother, and I think we shouldn't forget that and the impact that it's having on that family. And as Maggie says, they're doing this in the public, it's in the press, the news channels are there 24 hours a day. And I think equally watching the news channels can make you feel quite upset as well, and I've had to, as an individual, stop watching the news at times to give myself some rest and respite from some of that story. So they're just my personal reflections.
Yeah. Shall I just give mine? I'll just give mine. So I think, and the bit for me, there's a couple of things. I think there's something about actually we're all now just currently as a part of history, if that makes sense, which is just a little bit strange, and you know, quite powerful. I think the other thing is, unless something terribly goes wrong in my lifetime, I will never have another queen, which again is just, you know, just really interesting. And then finally, you know, I lost my mother a couple of years ago, 2.5 years ago or something like that, and of course it's just sort of a bit poignant from that point of view, I think. So yeah, and it's, I'm interested in, I won't go into it, Maggie, but it's interesting how some our children are impacted and what they feel about this, and it's easy for us to forget that side of things. Okay, I'm going to move us on, and just, oh well, the other thing I was going to say is that, you know, I've obviously marked the respect by, you know, I usually wear a suit to work, but I brought a black tie, just to mark my respect, really, I guess. So I'm going to move us on to the bank holiday Monday, which is the funeral day, and my understanding, and Debbie is much better at this than me and will be able to explain all of this. This is not what we call a statutory bank holiday. It's a different bank holiday, recognising that we've had less than a week's notice, really, or just about a week's notice, to try and sort this out and to try and think about how we might continue to run our hospital in the face of changing something dramatic in a few days. So Debbie, let me hand over to you.
Thanks, Dave. And you're right. So the government announced over the weekend that the day of the funeral, the 19th of September, will be recognised as a national bank holiday. But there is no statutory entitlement to time off on the day in relation to the other bank holidays that are identified within the calendar and the financial year. But what, as an organisation, we have done is recognise the bank holiday and recognise that people will want to pay their respects, and therefore there is a lot of work being undertaken to understand, and Maggie will come on to, in relation to service that will be running over on that day. But because we have recognised Monday the 19th as a bank holiday, in terms of our terms and conditions, we have outlined that our national terms and conditions will prevail in relation to bank holiday entitlement. And what I mean in terms of that is that individuals on Agenda for Change terms and conditions will receive a pro rata bank holiday entitlement in accordance with Section 13 of Agenda for Change terms and conditions. And equally, medical and dental staff who are required to work on that day will receive a lieu day. With that in mind, Agenda for Change staff who work on Monday will be entitled to receive unsocial hours payments in accordance with Agenda for Change terms and conditions, and we call them enhancements. And some communications has gone around managers today in relation to how they need to facilitate that. So that pro rata entitlement for increase in leave will be added to individuals' leaves entitlement And then individuals who are not required to work on Monday will need to book the time off that they usually work on Monday to take the Monday off. And clearly Maggie will come on to the services and how that's been assessed, but managers will be speaking to staff in relation to whether department services are open on Monday or not, in accordance with the national guidance, but also the decision locally that we've taken to support and recognise Monday as a bank holiday. So there's a lot of information on the intranet in relation to annual leave and bank holiday. We have a policy which will prevail in these circumstances, which really identify how leave should be taken, hours to be taken, etc. And as I say, managers will be amending leave entitlements, and there is a grid for managers which clearly identifies how many hours individuals are entitled to on Monday, depending on the number of hours that individuals work on a weekly basis. Thank you, Dave.
Okay, so we may get some questions on that, so I'm going to get Danny to keep an eye on the questions. But just a couple of points of clarification. So I think so. There's this difference between statutory bank holiday and a bank holiday granted for this aspect. There's the concept that we're going to try and honour conventional bank holiday, so rates of pay or enhanced rates of pay, time off is exactly the same as if it was any other bank holiday. But those people who are not working need to book the time off in terms of their normal, so as we would do for a bank holiday. And of course, it's really difficult because we've got to balance that recognizing, you know, the conversation we've just had, recognizing what people might wish and want to do, recognizing that that's not everyone, and of course as a healthcare provider we've got to continue to provide care for our patients. Some people don't want to have a day off, they prefer to have a different day off, I would presume. So we can't really have a blanket cancellation of all activity. We've got people who've been waiting, well, years for procedures who might be scheduled for Monday, or they might be on cancer pathways, or all those sort of things. So it's I have to say it's quite difficult to sort of navigate a fair and easy way through this, but that's the clear sort of HR guidance that gives us the structure. So I'm going to look for any questions there. What about those staff who do not work on a Monday? Do they still get the pro rata leave entitlement?
Yes, so the proposal is that individuals who don't work on a Monday, because we're treating this like any other bank holiday in terms of leave entitlement, in terms of pay, etc., that those who don't work on a Monday, for example, will still receive a pro rata entitlement to take elsewhere.
Okay, and I've got another one. Which might be a bit provocative. It might be a genuine question. It says, will HR be working on the bank holiday Monday?
So we'll be making an assessment in terms of our service with regards to whether we need to be in on that day, and then we'll communicate out and see if we're running an essential services and link in with Maggie from an operational perspective as to whether HR is required. But it's certainly that we are in discussion as to whether a service needs to be provided on that day.
Lovely. I don't know. I might have one more. If someone works part-time but works a full day on a Monday, so someone works part-time but works a full day on a Monday and doesn't have sufficient leave left to book the additional hours, how would that work? They're given additional hours, aren't they? Because it's a bank holiday.
So they're given additional hours. If somebody works 37.5 hours, for example, they will receive a 7.5 hour entitlement. If somebody works 22.5 hours, for example, they may only be entitled to an additional 4.5 hours. If they have no annual leave left, what we're saying is normal bank holiday terms and conditions prevail. So individuals would book the time that they're due to work on the Monday. If individuals are saying they don't have a leave left to take, then that will need to have a discussion with their line manager in terms of what discussion and what agreement can be made on an individual basis.
Okay, and I think all of this is coming back to we're trying to do this as best we can, working through the vagaries and the complexities. Are there any plans for a book of condolence at Newark or Mansfield community? I think that's a great question and very valid. I did, when I looked at the comms last night, that was exactly my question. Certainly that will be something that we might want to do. So I might just take that away if that's all right, and just see what we can do about a book of condolence at our other hospitals. Okay, and I've got one final question for you, Debbie, which again might be a bit provocative. So at some stage in the future, we're going to go through a coronation of the new king, which will be an equally important moment in history. What do you think is going to happen when we have a coronation?
So I think it depends on the day of the week the coronation will occur. So will it be a weekend or a weekday? If it's a weekday, we will again wait for national guidance to come out from the government. If they announce that it will be a bank holiday, then we will hopefully, I think what this situation has presented us with is that we've had very little notification and time to be able to plan for this. Usually bank holidays we're aware of, you know, years in advance. We know when the bank holidays are, whereas in this occasion we've only had a week to prepare and come up with things. We won't have got everything right. We recognise that. We're just trying to do the best for our people and our patients. So if it's announced on a weekday, if the government announced that it's a bank holiday, again, we'll make the assessments. What we've done in this situation is we've talked to our system colleagues, and there is a consistent approach across the system. We'd do that again. And if it's recognised as a bank holiday and as an organisation and system we recognise it as a bank holiday, then I would suggest that our national terms and conditions would prevail on that day. But clearly, if that happens, hopefully we'd have a lot more notice to be able to plan for it. And it's just very exceptional circumstances in this situation.
Okay, great. I've got another comment, or a few comments I've put into the chat. People saying thank you for sharing our thoughts at the start. But there's I said it right at the beginning. There's an online book of condolences on the Royal Family's website, and we'll put that into the chat so people can see that. I have several. This is from Stephanie. I have several team members who would rather work. This will obviously impact the budget with enhancements that need to be paid. I'm assuming we need to be sensible in how many people work. Yeah, so I think there's no question that we're going to run the hospital as a normal day, but this is about providing what services we can. And of course, it's going to be difficult with the schools being off. It's going to be difficult with presumably there'll be a reduction in public transport, all of those sort of aspects. So maybe I'll use that as a prompt to get into talking about some of the operational side of things with Maggie, who's got the unenviable task of trying to navigate through some of these vagaries and complexities. Maggie.
Thanks, Dave. So, you know, just picking up on what both Debbie and Dave have said, the pace at which we're having to do this is out with what we would normally do around a bank holiday. So usually whilst planning brings forth its own issues, its own unique issues, generally we've got some time to look at what we're doing to plan for things. Now we're having to do it within a week, which is very, very difficult. So as already stated, we are keen to give as many people as possible the opportunity and the time to pay their respects, whilst maintaining you know, Sherwood Forest's excellent level of patient care. But we have to be committed to minimising the impact on the patients and ensuring that they can still access the services that we have. We have lots of patients who've been waiting a very long time for operations. We've got patients in the hospital who are waiting for cancer care. We've got patients outside who are waiting for cancer care. So we have to make sure that we are looking after everybody's needs. We are meeting as a team or as a leadership team with the divisions and supporting services to see what is feasible to remain open and what we absolutely must have open over the bank holiday. And the divisional managers and clinical teams are working through any bank holiday closures and what the impact will be on staff and patients, so that we have a real clear understanding of what that looks like. Detailed arrangements should be available later on this afternoon, because we are meeting with all the divisional plans this afternoon, and a lot of you will already have been consulted on whether your service is a supporting service and should remain, or has a significant patient impact or staff impact and should remain. So you should have already been consulted about that. But we will prioritise our highest priority patients on that day and make sure that we've got the services and support services around to ensure that they have the care that they need. As soon as the plans are firmed up, your line manager will be able to let you know your local arrangements for the services that are going to remain in place. But we are hoping that that will be, if not the end of today, then certainly tomorrow, that you will know about that, because you also need to be able to make some plans for childcare, etc. For our patients, we will be taking down some services. We will be taking down a lot of our outpatient services, but we will be letting patients know by one or more of three main ways. So we will contact all of our patients who have an inpatient operation, and we will be contacting them by telephone. We will also send them a letter just to make sure, and we will send them a text. For our outpatients, we will be sending them a letter and a text to let them know whether their appointment has been cancelled or not. And we are already going through the process of understanding when we will be able to get those patients back in again, and they will be prioritised. Any patient who is not going to attend or doesn't intend to attend, on the text message and the letter, we will be asking them to let us know. So there will be a fair bit of communication coming our way from our patients into our appointment centres and into services. So just be aware of that over the next couple of days. And I'm sure that you've already started to receive some of those questions anyway. I think really that's everything that we've got just now. Updates in comms, updates from your local line managers. If there's any problem whatsoever, then I'm always here. If you need any further clarification that you're not receiving anywhere else, or you think that we've missed something, then please do get in contact.
Yeah, it's really complex, isn't it? And a key component of this is sort of communicating, not obviously with our team so we all know what's happening, but actually with the patients who are stuck wondering what's happening. And as you say, you know, there will be some people who've been waiting a long period of time. There'll be people here who are waiting urgent procedures and tests, and trying to then create an extra day in effect further down the line is going to be really hard for us, particularly if there's more disruption. And do we have any sensation of what our patients want? Do they want to come into the organisation on Monday, or do they want to stay away?
So we don't know yet, but I'm assuming, well, I'm not assuming, I absolutely know that as soon as we start to send communications out to patients, they will ring and let us know what they want to do, because there will be some patients who will have their outpatient appointment cancelled because we haven't got the service running, who will be upset because they wanted to come. Equally, however, there will be some patients where we are running a service who will not turn up and don't want to come on that day for all of the reasons that we are having a bank holiday, because they'll want to mark their own respects. So I think we'll have a better idea of that once we start sending communications out. Yeah,
and just who's doing all that communication with the patients? That's all devolved down to the individual teams. We haven't got any global communication that we're doing. We're obviously putting out some comms onto our website, and we're putting something out into our system as it goes. But in terms of actually phoning patients who are due to have procedures on the Monday, we're doing that in the individual teams, are we?
Yeah, so the specialty teams will be bringing out to the patients that sit within their specialties.
Yeah.
And from a letter and text point of view, we will be doing that centrally.
Lovely. Okay. So I've got a few questions here. Debbie, I don't know if you can see any of these questions. You can. Oh, that's handy. So the first one is, am I entitled to additional hours for bank holidays on a Friday? If I don't work on a Friday, as staff get an additional hours for bank holidays on a Monday if they don't work on a Monday?
So thanks. Yeah, I can see that one. So the entitlement is based on the number of contracted hours an individual works. For example, if somebody works 37.5 hours, they will receive a 7.5 hour additional bank holiday entitlement. If somebody works 22.5 hours contractual a week, regardless of what days they work during the week, they will receive, I think it's 4.5 hours additional bank holiday entitlement. So it's not based on the days of the week individuals work, it's based on the contracted hours that individuals work. I hope that makes sense.
Okay, and I'm going to move on to the next one. If a staff member wants to work but their service is not deemed essential, would they still get enhanced pay for working? If we're not running a service,
if we're not running a service, an individual will be given bank holiday entitlement to take that day off.
Okay. And then so we've got, when will we know for sure if we are off on Monday? Who wants to take that one?
So we should know latest tomorrow whether you're off on Monday or not, because we're going through the services today. We have a detailed list of all of the services that are coming to a meeting directly after this, that we'll then be able to let people know.
Okay, and then just the final question I think I've got is, we have a book of remembrance at Newark, and I have one I can drop off at MCH. That's from Rob Herb, chaplain. Rob, just can you put in the chat where those are? So I know the book of remembrance at Kings Mills in the Faith Centre. Can you just put in the chat where Newark and Mansfield Community will be situated? That'd be great. Thank you for that. Okay, lovely. I'm going to move us on, if that's all right, to COVID vaccines. So I know it's sort of a bit of a different topic, but we started the autumn booster programme yesterday, and I went down to the vaccination centre, had a wander around. Kim, do you want to come in and tell us what's happening at the vaccine centre? Who can get a vaccine? How many people you had through yesterday? And what type of vaccine it is?
I can, thank you, Dave. Yep, so the autumn booster campaign for the COVID programme started yesterday, and we are currently offering the vaccine to health and social care workers, people aged over 65, carers and pregnant ladies. The intention is over the next coming weeks we will see that offer being extended to anybody over 50. Along with the previous cohorts mentioned. We are open Monday to Friday, 8 till 8, and appointments can be made on the National Booking Service, which is via the NHS website. Equally, we currently, for this week, have walk-in appointments protected for our staff. Not knowing what the uptake was going to be like, we wanted to protect those for staff that want to just pop in, make it a quick visit, as you did. So that is also an option. We'll be vaccinating till 7 o'clock on an evening, Monday to Friday, and 1 o'clock on the Saturday when we're open 8 till 2. The vaccine currently available is Moderna, so that's acknowledging that it's going to be slightly different from what we're used to as staff, because most of us would have had the Pfizer vaccine, but as you know, this is the vaccine that the government have decided to use as the booster, offering that additional coverage for the additional strains being identified at the moment. So far so good. People that had the vaccine yesterday not experiencing many side effects today. So We will be having, I know there was an handful of staff that required the AZ vaccine, so that is no longer available as of the end of August, but an alternative will be available again within the next coming weeks, and we are lucky enough to be able to provide that and offer that to staff as an hospital hub.
Perfect, that's really clear. So just to clarify even more a few things. So the Moderna vaccine is an mRNA vaccine, so it's the same type of vaccine as the Pfizer vaccine that the majority of our colleagues got, but this is a new vaccine. It's what's called a bivalent vaccine. It's been through all the checks. It's been approved by the MHRA, but it gives vaccine or vaccination against not just the original variant, the BA1 variant, but some of the newer variants, the BA4 variants that we've seen. What we don't know is what it will be like for future variants, because they're all changing as we go through. There are a couple of other variants circulating around at the moment. There's the 2.75 and there's the, is it 4.6? I can't remember, but there are a couple of other variants which are really quite endemic in places like the United States, and we've got them in the UK as well. But I would strongly encourage everyone to have an updated vaccine. We've seen, so my background is critical care, so when we started this we had a critical care that was absolutely swamped with COVID patients. Now because of the vaccine program, we see rarely patients in critical care. We do occasionally, but we see rarely in critical care. The organisation is still very busy. We've got around about 84 or something COVID patients in the organisation, of which just about 50, well, just over 50% of those I think are sort of within their infectious period. So we're seeing COVID coming and going a bit like a roller coaster, certainly over the past few weeks, but is certainly still out there. We certainly anticipate that there will be an increase in the community spread of COVID, particularly related to everyone going back to work, all the kids going back to school, and all of those dodgy students going into their fresher weeks. So we think that will happen. Just what's the evergreen offer, Kim, and what we're doing about that?
The evergreen offer is for people that may have not taken a vaccine at all, and that's something that we continue to offer in the hub daily. And what we have done to concentrate on the boosters is consolidated that clinic, so that is the last hour of every day, so again Monday to Friday and on the Saturday. So that is the Pfizer vaccine, and that is for people that may still need a first, second or the third dose, which is what we class as the primary course date. So that is still available again as a walk-in. You're able to get that, and surprisingly we're still getting people come in for those first and second doses, which is great. Yesterday we had 403 people come for a vaccine, which again is a positive start. And we've got more booked in today, but we're keen again to be able to take walk-ins. So for staff, as before, if you can bring your ID badge, if you've got your NHS number on the app, that's fantastic, but if not, we can support you with that. And we're just wanting to make this accessible to everybody to come and get.
And there's no 15-minute wait. It's in there, get your vaccine. As long as you haven't fallen on the floor, you're able to walk there, but we just ask that you don't go and drive straight away. Yeah. And you're just sensible about all these things. Okay, and the AZ vaccine, so the evergreen thing, the reason we're doing it at the end of the day is we just don't want to mix vaccines and create any sort of risks. So I think that's very sensible. The AZ vaccine was given to a relatively few number of our colleagues, and that was people who were unable to have the other vaccines due to components. And so we've got, as Kim says, we've got an alternative to that. Okay, now I've got some questions, Kim, for you. It says, are vaccinations available at Newark?
So the ICB have arranged a number of pop-up sites over at Newark, Dave, as well as community pharmacists. So there are details around that I'm sure comms will circulate for staff.
So it's primarily around GP practices and those aspects. We haven't got a hospital hub at Newark. We only, so that it's quite tight, the regulations and restrictions about where and whatever. I think we want to, whatever it is, 28 hospital hubs or something like that. So we're only allowed to have it in one particular place. It says, where is the vaccine hub currently located? Very good question, because we moved it.
We did. We had a move. The beginning of the year, wasn't it? April. Yeah, so we're now in Adam's old space at the occupational health office in the bottom of TB3. So there's parking available in the car park 9, just in front of TB3, as it was before. Well, we're on the ground floor, so it's accessible for all.
Okay, and there's a very cheeky question. I don't know which of you is asking this. It says, did you experience any side effects, Dave? So okay, so I did have my vaccine yesterday. I have to say, and all due credit to the a colleague who gave me the vaccine, I don't think I actually felt the needle at all, and I felt fine, to be honest with you. I've got a bit of a sore arm, but as I was saying to Kim, I've got a sore other arm, so I think that's maybe just be a bit of old age, but I feel fine from that. Okay, so we're going to get to flu in a minute. So there's a question about flu. When do you foresee the vaccine to be open to NHS staff? It is open to NHS staff. It's absolutely open to NHS staff. That's why I'm saying to you, get yourself down there, get yourself vaccinated, and then you're protected from that point of view. Okay, let me move us on then. Our staff that are not frontline eligible for a vaccination. So that's all NHS staff. So just bring your badge, come down and get your vaccine. There's another one on annual leave. I'll come back to that. Our children 12 to 16 classed as clinically vulnerable. Kim, so should we bounce that to the criteria? Is that an easier one there? Our children aged 12 to 16 classed as clinically vulnerable. Sorry, classed as clinically vulnerable and immunocompromised for initial vaccinations eligible for seasonal vaccine. If so, what vaccine would they get?
Yeah, so it would be referring back to the JVCI, Dave, the guidance around that. So it would be the same vaccine. If they're under 18, obviously it would be the Pfizer or a paediatric Pfizer, depending on their age. And again, whilst we offer, it will be offered at some point over the coming weeks. Currently, it is over 65s. Health and social care staff, pregnant ladies and carers. So it's just around keeping your eye out for national comms and obviously the comms that we do at SFH. Perfect.
Okay. Someone's put here, I had my vaccine yesterday, turned up a day early. The team were friendly and efficient. Having worked in respiratory, I've seen firsthand the importance of having a COVID vaccine to protect yourself. Yeah, that's helpful. Okay, let's go on to flu, Adam, recognising I've been talking too much. What about, there's some questions in here, what about the flu vaccine? And can we get it at the same time?
Yeah, thanks, Dave. I'll answer that before I start talking through the sort of plan for flu. Yeah, absolutely. There's no issues this time around with having flu and COVID vaccine at the same time. I'll talk through the plan and talk a bit more about the vaccine hub and how we're going to work together on flu in a second. I think most people will be well drilled in the flu goings on at Sherwood Forest now. This is my first full year, so I'm looking forward to seeing that legendary Sherwood Forest response to flu vaccination. We're anticipating the vaccines arriving the week commencing the 26th of September, and we've got our clinics planned to start on Monday the 3rd of October. There's 2 types of vaccine this year. The majority that we've ordered, the bulk of our vaccines are egg-free vaccines, and they'll be carried by all vaccinators, peer vaccinators, OH, etc. We've got a smaller number of vaccines which are going to be dedicated for our colleagues who are 65 and over, and they are not egg-free, and they will be only carried by occupational health staff. So any staff over 65 can be vaccinated in occupational health. Similar to previous years with our approach, we'll be trying to maximise the opportunity for staff to get vaccinated, so there'll be bookable appointments in occupational health. grab a jab clinics, OH staff roaming around, and Kim's team have kindly offered to help us out this year with signing up to the peer vaccinator programme as well. So any staff that attend the vaccine hub for a COVID vaccine will also be able to access a flu vaccine as well. So we've got hopefully every opportunity covered for staff to get a vaccine. Incentives will be very similar to previous years as well. There'll be a meal deal voucher for any staff who get vaccinated. Everyone who is vaccinated each month, October, November and December, will be entered into a prize draw, and there'll be a grand prize at the end of the year as well. And to say a thank you for our colleagues who are signing up to the peer vaccination programme as well, and are vaccinating our colleagues. For every 50 vaccines that our peer vaccinators give, they'll be given a £20 high street voucher as a thank you as well.
Brilliant, really clear, and I'm sure it's been mentioned, but we usually track the flu season in Australia. We've been watching the flu season. It's been a big flu season, biggest for the last 3 or 4 years. It's been a very early flu season, which is why we're really keen to get this vaccine out just as soon as we get supplies. It's primarily, we think, flu A that's occurring in Australia, and our vaccine hopefully will cover all of that. It's a quadrivalent vaccine. That means it's got 4 components there, if I've got that right. So I would encourage you to have that. What I would also say is that we haven't got a dual COVID flu vaccine as yet. So these are separate vaccines. They also are some nuances about who can give which because of the legal ramifications. COVID vaccines are authorised under emergency powers, so they are just have different regulations associated with them. But these are vaccinations that each and all of us should try and get. So, Adam, there might be some questions here. If I have my annual flu jab at Boots, as I'm over 50 and have this booked already, will occupational health still need to know that I'm covered still, or it doesn't matter?
No, please do let us know if you get your vaccine anywhere other than on site. Let us know and we'll record it as normal.
And this was one of my questions. Is there going to be an opportunity to donate the meal deal to the people who are perhaps very needy?
Yeah, this time round, unfortunately, we won't have that option given to us. So staff who are issued a meal deal voucher will only be able to redeem it themselves at the Spice of Life cafes.
We're not able to work with our street health colleagues or anything like that to make that happen.
Not this time round.
Okay, I've got a couple in here. This might be someone who works in occupational health. Big thanks to Unison for donating the prizes for a monthly prize draw. And then the final question I've got is, when will this is back to annual leave, when will the annual leave calculators be updated on the intranet, still showing us 9 days bank holidays? I think that's just work in progress, isn't it, Debbie?
Yeah, so we're hoping to get that done at ASAP, but as I say, there has been an email round to managers today to provide a grid which clearly identifies allocations, but we are working on updating the annual leave calculators and getting that up to date on the intranet, hopefully by the end of today.
Lovely. Okay, so I'm going to draw it to a close because we've overrun a bit. I think it's important we feed back to our chief executive. This has been the best ever staff brief, and thank you to my guests for that. And we'll obviously give him some adjusted figures about the number of people watching, but certainly a great number of questions. Any last thoughts on any of that from any of you? Debbie, any last minute thoughts from you? Look at that, 118 people. Fantastic. Was that's today, but of course it'll be 118,000 shortly when it goes live. Debbie, any last thoughts?
No, just thank you to everybody, and just take some time for yourself and your families over the coming days.
Maggie, you've got a fiendishly tricky task with all of this operationalization of this. I am in awe of you, but any last thoughts from that?
I suppose it's just to say that whilst we are planning for a bank holiday, it is extremely busy out there still currently, and we appreciate everything that everybody's doing at the moment, trying to keep our patients safe in the numbers that they're attending the hospital. So whilst we are planning to have a better bank holiday for staff and patients. We do really appreciate everything that you're doing so far.
Very, very busy out there. Thank you, Maggie. Kim, your message is just get yourself down the vaccination centre and roll your shirt up.
We are open Monday. I forgot to mention, Dave. We'll still be open 8 to on Monday with walk-ins.
Excellent. Excellent. Thank you. Oh, have we got all that information on the web, on our web page? Is that all out there?
Working with Richard and the team to get that updated as we speak.
And maybe we put the JCVI guidance on there as well, so people can see that, if that's all right. Lovely. Adam, what's the date again? We can get some flu vaccines?
3rd of October, clinic start.
3rd of October. Excellent. Any final thoughts from you?
Just again stressing the importance of getting that vaccine. It's a really important part of our arsenal of protecting ourselves, colleagues, patients and families.
Yeah, really helpful. Okay, the last thing from me is we've been sent a request by the NHS around doing a survey on what gloves we use, and there's a link. We'll post that link as part of the information of this, but we've been asked to complete that so we can select gloves that hopefully we'll all like. And then finally, I'd just say thank you for your interest in the staff brief. I thought it was really powerful, some of our reflections, and thank you for those, Debbie and Maggie. I think it's an uncertain time, isn't it? And it's affecting us all in different ways. So look after yourself. All of those wellbeing resources are in that comms that went out yesterday. We'll reissue that as we update it. Thank you. Have a good rest of the day.